Hello everyone, my name is Damian DeLister. I'm with United Insurance, and today we're going to be discussing some things about Medicare and supplemental insurance. I've been doing Medicare sales for around 20 plus years, and also I'm going to be discussing that with my associate.
Hi everybody, my name is Clinton McPherson. I'm also with United Insurance. I've been pretty much doing insurance for about 5 years now, and I started off with Medicare supplements and health insurance, so this should be a great day.
All right, so let's talk about Medicare, Clint. We can briefly cap upon Medicare, what we talked about the last time.
Okay.
So we have Medicare Part A, which is the larger amounts, right? The $1,500 to
Correct.
20%. So I'm going to discuss some of the plans that used to be there.
Okay.
And then we'll talk about some of the common plans, and then I'm going to have you talk about some plans that are a little off the beating path, but they're still subjective, right?
Right.
So we got the F plan, which was the Cadillac of plans.
Right.
Because of the macro law, they discontinued that plan of 21, so the F plan is no longer available. But let's talk about what the F used to do. So the F would cover 100% of Medicare A and B. Basically, someone had no out-of-pocket.
Everything.
You remember that?
Yeah, I do.
People loved the plan, right? You know, the funny thing is, I used to talk more people out of the F plan and get them on the G plan, even when the F was available, because the money what you would spend to buy that F plan, you were actually losing money just avoiding paying a $200 deductible,
Right.
188 deductible, remember?
The 188 deductible.
Right. So I don't know if you remember this. I remember this, but before the F was the J plan. And the J plan is like the F, but it had drug coverage built into it.
Yeah, and they discontinued that
You
one
would
really
have to
quick.
pry that out of somebody's dead
Right.
hands, right? So the J plan was a great plan, but what Medicare did is they made it so their drug coverage wasn't strong enough for the drug coverage to be built in the plan. That plan eventually got discontinued, and then the F was introduced, right?
Right.
Along with the F plan, we had the high deductible F. You remember that,
High
right?
deductible F.
Right, you had to come out of pocket the first $2,300, and then once that was met,
Everything was pretty much covered for you.
basically, it was a glorified plan. I never really saw what it did, because you still had to worry about the 20% on certain things, and there were a
Yeah.
lot of holes. It was a very inexpensive plan for a reason. It really didn't sell big. I know they replaced that with another plan, but I'll let you get into that. So what I'm going to also talk to you about are what I feel are the most popular plans I focus on.
Okay.
So in Pennsylvania and Ohio and places that do work on assignment meaning those doctors agree to take what Medicare's offering them, right?
Right.
So with those assignment plans, they have a plan called C plan, not to be confused with the Advantage plan, but the C plan's available there. It's very similar to the G plan, although the only thing you really have to worry about is the excess charge, which ties into assignment, if you know what that is.
Yes,
you want
I
to
do.
explain an excess charge to people?
So the excess charge is literally, if I'm correct here, you go get whatever you're going to get done with the doctor, and then whatever Medicare does not cover, that overage would be considered the excess charge, and then
Right.
you would be responsible for that charge.
Right, so if the doctor wasn't willing to accept what Medicare was saying, hey, this is a billable service, this is what we think is fair, and the doctor says, no, I'd like a little more, they're able to go after your client for that excess charge, right?
Right.
So then I come into what I think is the golden boy of the industry, which is the G plan. Hence G for golden, right?
Yes.
100% coverage for hospitalization, which you gotta love, right?
Can't beat
Pretty
that.
moderately priced throughout the southeastern United States and the Midwest. You give them the 20% on both sides, A and B, and the only thing your client has to worry about is a $233 annual deductible.
That's right.
So I don't know if you like it, what your feedback is on the G.
Personally, I think that's the best plan on the market.
I agree 100%. I
Because-
push that plan. To me, that plan is going to make the most sense for somebody that's secure financially. They want a plug and play program. The most they ever have to worry about is $233
For the
Set
entire
it,
year.
Forget it, right?
Yeah.
My next favorite plan is the N plan.
N plan is a good
I
one
hear
too.
you selling N plans all the time, right?
Yes.
So an N plan is almost identical to the G plan. The only difference is it does cover 100% for the hospitalization, which is the scary part. It does cover the 20%. You're responsible for the deductible, and you have a $20 copay to your primary, $20 copay to the specialist, $50 copay to urgent care, but if you're admitted, they waive that.
They waive it.
The other thing is the excess charge, but I don't know. In my time doing that, have you ever had anybody who's got an excess charge?
No, not since I've started.
Right. I mean, if they get it, it's probably such a minuscule charge you don't even pay
Nobody
attention. You
ever
probably think
calls
it's going
us.
towards your deductible, right?
Right.
I don't know. I like the end plan. The end plan is for my client that's not going to the doctor every time they have a runny nose. Someone that wants the ability to go to any doctor, wants to travel, but they still don't want to pay that top price as a G. I recommend them to the end plan. So those are the three plans that I was going to cover. What do you want to talk about?
Oh, well, I was going to just piggyback off of you and say a lot of my clients, well, not a lot of them, but some of them, they see a lot of specialists and they have a lot of appointments. I always advise them to go and get their testing done and everything in the beginning of the year so that they can knock out their annual deductible early in the year. And that way, for the rest of the year, you're pretty much free.
Right.
You don't have to pay anything
That's a good strategy.
out of pocket. So that's just some advice for you guys, when you're looking at supplements. I guess the plans that I'm going to talk about, these aren't as common, but they are there. One plan is called the L plan through Medicare Supplement. This plan is going to cover you 75%, and then you're going to cap off at about was it $3,300 for the year.
You're better off going Advantage.
Better off getting an Advantage plan because now the new Advantage plans, they're going to cover a lot more than that, actually.
Plus 25%. It can be a scary number, man.
Yeah.
It can be a scary number.
25% of a hospital bill is a
or
big
even
bill.
a doctor or MRI. Think
Yeah.
about it.
So, I mean, financially, it doesn't make sense.
And its price point is like right at the end, if not a little more in most states.
Might as well get a better plan.
Right. I agree.
The next one I'm going to mention is the K plan. Now, the
worse.
K plan is even worse than the L plan because the K plan only covers 50% of everything. So now you're responsible for half, and then they're going to cap you off at right around $6,600 for the year. So, again, these two plans really aren't the best plans, but
But some agents in some markets, they focus on these plans because, again, people just hear Medicare Supplement, they think they're going to be protected, but then they have a problem where they're getting prescribed a bunch of tests. They come home and then there's a bill in the mailbox
they're out
and
of
that
pocket.
50% or that 25%, and those numbers add up to bigger numbers.
I think the only good thing I can say about the K and the L is if you are on this type of plan, you're not restricted.
Agreed. And
That's the only positive I can come up with.
Medicare is still the primary bill payer, which is a big deal, right?
Yeah.
I just think, listen, at the price point, what the K and the L is available to, you're
just so much
better off
better.
with an N and a G.
Right.
You're talking a difference of maybe a few dollars. It's not like the C plan where you have all that coverage, but the C plan is kind of a niche market. You're really looking at PA and Ohio,
Right.
and I think Michigan, really for that plan.
Yeah.
Are there any other med subs that you feel are relevant for our conversation today? To me, I've touched what I endorse.
There is one more that I know you know about it too, the high deductible G plan.
To replace the high deductible F.
And that plan, let's see, it's going to cap you off at you're responsible for, is it $2,600?
It's 26 or 27. I think it went up a little bit. But you're coming out of pocket up front.
Up front, you're going to be coming out of pocket for $2,600 on everything.
A and B.
Yeah. So just think about it. Something happens and you go to the hospital, automatically you're owing $2,600, $2,700.
And at a $50 price point on average for male or female for a high deductible G plan, I'd rather put somebody on an N.
Yeah.
Or if they can afford the other $40, because you're talking about a difference in $40, but then you're saving $2,000 in deductible.
Automatically.
Or just go to a zero premium PPO at that point. Really and truly,
it doesn't make sense. Financially, it just doesn't make sense to. I always advise my clients on the G or an N plan. I mean, I focus on those because I believe those are in their best interest.
I'm in complete agreement. To me, it takes away the financial burden that people are going to run into.
Yes.
And to me, when you hand a doctor a card and they're looking at that name on the card, even if it's a no-name company, they're still going to understand what Medicare does. With those K and those L plans, because they see them so infrequently, it causes confusion. So to me, I say stick to your guns, sell what you believe in. Sometimes the client just needs to understand and break the numbers down for them based on their medical questions, and put them in the best possible position.
I couldn't agree more.
That's kind of all I have on that.
Well, good talk today, sir. And
Always.
if you guys have any questions for as far as Medicare supplements or even Advantage plans, you can give us a call right here at 1-800-339-4112, or you can reach us online at myunitedinsurance.com.
Thank you.